new year is in full swing, which means you're more than likely making some of those New Year's resolutions to look and feel better in 2020. Here to share some tips and more is Dr. Melanie Palm, and Medical Director of the Art and Skin MD. Good morning.
Good morning to you.
So a lot of people are, hey, new year, new me, the gyms are packed. What are some ways that people can go and achieve that and maybe do some things non-invasively?
Yeah, so that's a great question. Many of us overindulge a little bit over the holidays, and many of us have gone on vacations and we're not on our typical routine. And so when I see patients about sort of body contouring events, I talk to them a little bit about, we really want you to first and foremost be in a good place diet and exercise wise. So none of the procedures we're going to talk about are a means of losing weight, but I think they are for stubborn areas of fat or people who are maybe losing a little bit of muscle tone. We'll talk about some muscle technologies to be able to build up your core and build up muscle again, and really help improve our overall health with things that also improve us aesthetically.
Okay, so what are the things that you can do? Some of these M-Sculpt,
Yes.
what is that?
So that's something really new to this space. So that happens to be one machine. There's actually going to be 3 of them, and they're all based off of this high intensity focused electromagnetic energy. And basically what that does is right now they're approved for the abdomen, for the buttocks, for the calves, and for the arms, although we sometimes use it in other areas. And it stimulates muscle contractions in the areas we do it. So patients typically come in about twice a week, for 2 weeks, so a total of 4 times. And every session, it's like doing 20,000 sit-ups or 20,000 squats. And so you can imagine it's able to super physiologically stimulate muscle contraction. And according to studies, builds muscle in a given area between about 11 and 16 to 17%. So we were a part of a study where we looked at the buttock, and it built 9 ounces of muscle over that time.
Wow.
And when you build muscle, you burn fat. So we also are starting to affect fat metabolism when we're affecting something called sarcopenia, which is loss of muscle.
Yeah, and tell me a little bit about Vanquish and CoolSculpting.
Yeah, so there's different ways to sort of vanquish fat.
Yeah.
There's ways to heat fat and make it so unhappy that it doesn't exist anymore, or we can cool fat. So many people are accustomed to what we call cryolipolysis, or you may have seen commercials about CoolSculpting.
Right.
And that's a way of freezing fat. The idea came about by something called cold paniculitis. When kids suck on too many cold popsicles, we notice they lose fat. And so that idea was exploited. And when we cool fat to a certain degree, about 20% of the fat goes away. So it's a non-invasive, no downtime way of treating the fat. Vanquish is one of the radio frequency procedures, and it heats fat so that it gets unstable and a certain percentage of the fat cells goes away. They're both non-invasive, no downtime, relatively not uncomfortable, and there's something that you can reduce a significant amount of fat in a trouble area, not the whole body.
And you said that there's going to be some new technology that's coming out this year. I mean, really to help more in the muscle area.
Yes.
So, I mean, these are just for problem areas, ways to help.
Yeah, and I think, the big thing that I talk to patients about is how fast they want results, where are their trouble areas, do they want to come in and do something non-invasive, or do they want to sort of one and done? And that's where something like liposuction actually comes in. So liposuction can be done just totally under local anesthetic. Sometimes it's done under general anesthetic. In that case, it does have some risks and complications that your physician should discuss with you, but that's a means of reducing fat in more bulk. We can actually eliminate up to 5 liters of fluid and the fat during a procedure in the state of California. So it's kind of up to you what you want to do, but first and foremost, good diet, good exercise. Once you're you're a happy weight, if you've got trouble areas that you want to tackle, there's lots of non-invasive and minimally invasive ways of getting you to that bikini bod by June.
There you go. That's the ultimate goal.
Yes.
Thank you so much, Dr. Melanie Palm.
My pleasure.
All right.